105.
Good evening, everyone. So let's see who we have. Uh, let's see. Hold on. All right, can you guys all hear me?
Yes.
Yes.
Perfect. Awesome. Tracy, how are you? I think all right, we have a good crowd today. Let's see. I'm just trying to give you guys all permission to talk. So we have 10 people that joined. Thank you guys all for joining this evening. Dr. Deschambault, Martine, how are you guys?
We're good. Hello.
Thank you.
Excellent. And I see Dr. Tan Garland. Can you hear me? Okay, maybe not. So
I was actually on mute there until I turned it off. I don't know if that was from you or from me. I hadn't done it on purpose.
yeah, no, you've all been unmuted, so you all have permission to talk. Um, so Dr. Garland, I'm not sure if you heard about Alphaflo before or not. I don't know if you can hear me. I don't think I've seen you before, so I may just do a quick introduction on what the product is. Let's see. Let's just give it a few more minutes. We have more people joining. And this evening we're gonna have Dr. Glasstein present a pretty nice case, an IVDD case. Actually, the first case from our clinical study that we're doing right now on 10 to 20 IVDD patients. So thank you, Dr. Gladstein, for doing that. When you're gonna present, I think I'm gonna make you a panelist so we can actually see you. We should be
Oh,
able to do that.
okay. Well, I would have gone to get my hair done had I known that.
Oh, it's okay. Look at me.
All right.
All right.
All right. So it says join as a panelist. Is that
Yeah,
what
you can join if you join as a panelist, and we'll see you'll be live just like the three of us. Uh, perfect. You are panelist now.
right? But no, you have a picture. That's it.
Yeah, I have a picture. Let's see here. Is your camera turned on?
Oh, well, yes, now it
There you go.
is.
Now we
Oh,
can
we
see you.
see you.
All right. Now we see me. Okay.
There you are.
Yes. Finally. All right.
Okay, so let's go ahead and get started. I'm going to do a brief overview. Dr. Garland, I see you now. Can you hear me?
Yes.
Perfect. So have you been introduced to Alphaflo before? This is your first exposure.
First time.
Perfect. So, well, thank you for joining. Where are you joining from?
Texas.
Texas. There you
Hey,
go.
absolutely.
Dr. Mark is from Texas. Where in Texas are you from?
College Station.
Oh, even better.
Very
Alma
good.
mater.
Well, yeah, so you guys are neighbors. Oh, we also have Dr. Sage Vilgatz. Right, we have a good amount of new vets this evening. This is awesome. Dr. Glassin, they're all joining to listen to you.
Great.
So, all right, well, let me give a brief overview for those who've already heard me say that a couple times. Just bear with me. And if you guys can just mute for the time being, so we don't have any echoes. So let me put this in presentation mode. So I'm Christian Baudry. I'm the co-founder and inventor of the product. I'm joined with Dr. Thomas Newman. Let me just mute. Here you go. So the co-host for the webinar, and this evening, Dr. Babette Gladstein is going to do our case presentation. So quickly, So this is really meant to be informal. It's just to give a brief background on what Alphaflo is, where it's from, and that we're gonna go straight into the case presentation and also any other cases you guys may have in mind, or anything that we can discuss between all of us here. So, Dr. Garland, I'm not sure if you have used other type of products for tissue regeneration, such as stem cells or PRP, but those are all of your disposal. They are intended to deliver, biopsy proteins to aid in the healing and repair, to augment healing and repair of injured tissues. Cells have been around for a very long time. Same thing with PRP, but they have their limitations. PRP is only going to deliver what's inside platelets, and stem cells will deliver cytokines and chemokines based upon interactions between tissues, but very often these cells may not survive, so you don't really get necessarily the clinical benefits that you're expecting from those cells. And then you have growth factors and anion-based products like what Alphaflo is. And these have been around for a very long time on the human side, going, literally like 100 years. But about 35 years ago, those tissues were used to develop clinical products following like GMP guidelines and FDA regulations, and they are now, commonly used in human patients. And we have one now that I created for horses 8 years ago, and Alphaflo is about 3 years old now on the market. So the product itself is derived from the amnion membrane, from the placenta, which is the inner membrane surrounding the fetus. It's a very thin membrane, but very, very strong and very rich in bioactive components. During gestations, the tissue has cells, and those cells will constantly secrete cytokines, chemokines, matrix, to help with fetus development, and to also provide anti-inflammatory, anti-fibrotic, and immunomodulation properties. And all of those proteins found in the tissue, which is well over 1,000, this has been very well studied on the human side, uh, and, and somewhat studied on the animal side, but we know there are thousands of proteins with known properties, again, to modulate inflammation, immunomodulation, even antibacterial, antiviral, and antifungal, uh, which is one of the reasons why this is an attractive source of tissue and proteins to help in treating patients and healing and repair. So using that tissue, I created Alphaflo. It's I developed a process to basically use the placenta. It's this green blob there that you see. I actually made a batch yesterday, a fairly large batch, but it took me a while to develop a process to basically clean that amnion into a nice sheet. And this is just one piece of it, but if I process 4 placentas, then I clean the entire placental sac, the amnion, and I use that. I clean it and then I micronize it into small pieces. It looks big on this picture here, but this is 500 times magnified. So these are micron-sized particles from the amnion membrane that is very rich in those bioactive components. So there are no cells. It's all proteins, chemokines, cytokines, HA, vesicles, like exosomes, and also scaffolding proteins, collagen, and so on and so forth. Post-implantation, you have proteins in suspension that will be delivered and act right away on the surrounding tissue and cells. But those particles will also release cytokines and those proteins over time. So I have data showing that the particles will release up to 1 month post-implantation. So I've done some in vitro bench testing in my lab to demonstrate that. So you have kind of a prolonged effect. And this is manufactured here in Phoenix in my lab, following GMP guidelines, good manufacturing practices guideline established by the FDA. And I'm following human standards basically to create this product. Here's a short list of what these cytokines and chemokines are and growth factors. Obviously, I did not quantify all 1,000 plus of them, but this is a short list of key ones. Anti-inflammatory molecules, A2M, IRAP, and IL-10. The TIM molecules are involved in inhibition of tissue destruction and tissue remodeling, very key to joint pathologies. And then you have the MCP1 or CCL2, which is a cytokine that is known to stimulate natural killer cells. And then IL-2 is a chemokine that also stimulate natural killer cells and T cells as well as IL-4. And then you have others, VEGF, which stimulates new blood vessel formation, and exosomes are small vesicles that would also contain a load. And the load could also be chemokines, cytokines, growth factors, and things that are important for cell-cell communication and involved in tissue regeneration. So again, this is just a short list, but think about Alphaflo of this, single solution that is comprised of all of those different molecules to aid and augment healing. It comes in 3 sizes, 0.51 and 2 cc vials. I would say the vet on the call will attest to that most the usage are either 1 or 2 cc vials. 2 cc is used often for a mix between IV and intraarticular injection, for example, or IP as well. And then we can discuss that when we're done with the case study as well. You can keep it in your regular freezer when you receive it. We ship everything on dry ice overnight. I keep it in my freezers in Phoenix at -80 Celsius for 2 years. Well, they have a 2-year shelf life, but I don't keep anything more than 6 months really. And then you guys in your lab, in your clinic, you can keep it in your regular freezer, just like a standard kitchen freezer, which is -20 Celsius. And we establish a 6 months shelf life. I've done some real-time testing on the proteins to demonstrate their stability under those conditions. And they can be purchased directly from us or any of your preferred distributors, Covetrus, MWI, Midwest Vet, and Patterson. So it has been used now in over 7,000 dogs. Our equine sister product has been used in 35,000 plus horses. It's been around for much longer. But the same type of applications we're seeing in dogs as well. Soft tissue lesions, tendon injuries, ligament injuries, and joints like OA cases, and more neoplasia cases and autoimmune diseases as well. So that's very briefly, that's an overview of what Alphaflo is. I'm happy to set up a separate call with anyone who wants to dive in more details about what Alphaflo is and other cases. I have, like a 45-minute presentation. But for this evening's webinar, Dr. Gladstein will discuss a IVDD case that she did. And Dr. Gladstein, the floor is yours, and they can also kind of introduce the study that we're doing with these cases.
Thank you. Yes, we were approached by a French Bulldog National Rescue Organization. Actually, I was approached to do some work for them because I had been exposed to dealing with some very difficult French Bulldog cases, whether I'd be interested. I immediately called Christian to see if he was interested in potentially participating with these cases with Alphaflo. So I'm doing them pro bono out of a small foundation that I run. And Alphaflo is contributing the Alphaflo, the amniotic fluid. And we've just finished our first case, and that's what we're going to present tonight. So this is a 4-year-old French Bulldog, female, spay, not walking at all. I mean, we have videos of her just dragging her hindquarters. She had no fecal or urinary continence. These are her x-rays, which you could see, and Dr. Nolan already went over them a little bit. And there's definite space problems in the thoracic and malformations as we're moving down the x-rays. But what we did was we actually were able to get a contributory CT scan from the Humane Society, and they were able to confirm the diagnosis that we were actually seeing on the screen. So they actually came up with left-sided disc herniation from L5 to L6, thoracic vertebrae malformation T6 to T9, and spondylosis in the cervical vertebrae, multifocal spondylosis. So I had examined the dog before I had actually gotten the x-rays, and I did the first acupuncture on the dog, only realizing that I had problems from what I could feel in the lumbar area, and obviously I thought low thoracic, so I wasn't completely correct just with the physical exam. So our next, this is what Potato looked like.
So I'll play this video here. This was on January 26th.
Right. That's the dog I was presented with. Now, once we got permission, I actually was able to administer the Alphaflo 1cc, 0.75 IV and 0.25 IP. And I did another acupuncture and stim at that time. That's right before I did it is 2.9. I think
Yeah, so this is right before you did it, right?
right when the first time when I really examined the dog. So you can see just from the first acupuncture that we actually were started to get some remission of clinical signs. But when we administered the Alphaflo on 215, now the whole case turned around. So we can, or got much better. So here is 2 weeks after that. Now, what I made the client do in the meantime was I made the client get a rug, a rough rug, just a rehab technique that I've used, which would actually increase proprioception by giving tactile response to the feet. And actually, it worked really, really, really well between that and the treatment of the Alphaflo. So here you have her walking the next day. Can we hit on that one? Okay,
Yeah.
there we go. This is the next day. Now, by this time, which is very fast from the time that we administered the Alphaflo on 215, the dog, if you can see, she's peeing. So when she's walking, she's peeing, which is better than totally not feeling when she's continent. So she's progressed now to actually going outside, sniffing, and starting to urinate, which is tremendous just after one treatment. And then we went to on a second treatment approximately a month later, and that's 322. Again, I did 0.5 and we changed it a little bit. We changed it up to 0.5 IM, excuse me, IP and 0.5 IV. And then I did another acupuncture and stim, and this is right.
So this one is right before.
Right, this is right before. And she's still wobbling and she doesn't have good proprioception. This is afterwards, just 4 days. That's pretty amazing. Now she's got full fecal continence, and I would say she's definitely knows she's urinating. So we're really back in the ball game. I think it's just a function of training. And if you notice, the knuckling on 326 has not completely stopped, but it's much better. So she's actually picking up that leg, even though she's dragging that left a little bit more. But this is only a few days after the second administration of Alphaflo, and very little intervention on my part, other than a doormat and a little acupuncture. That's our case.
That's a very nice case. And this dog got 2 rounds of Alphaflo. And the idea is to make these dogs so they can actually be adopted. And if I recall, Dr. Gladstein, this dog did get adopted.
Well, the dog is partially adopted. I mean, somebody has come forward for it, and it's just a function of us finalizing it after the holidays. The holidays are tough when you have these rescues, but somebody wants the dog. The dog's now desirable. She's a young, healthy dog to a greater than lesser degree. I mean, she'll always have some problems, but we have in our study, we've offered to have a 6-month look back and offer the veterinarian who may be taking care of this dog through the new owner another Alphaflo administration to make sure that this repair continues.
Yeah, and that's part of the study. So we're also going to monitor quality of life
Exactly.
with their new owner, and then, at 2 months, 3 months, and 6 months, and then just track how well they're doing.
Right.
Yeah.
Over what, a year to, what did you want to do? A year time frame on this, or
Yeah, well, we have up to 6 months, but if we can even look at 1 year after, that'll be great.
we get a look back?
Yeah.
So there'll be many more of these dogs that come in like this, but we'll salvage them and we'll make them adoptable, which is really quite something. And since the French Bulldog is the most popular dog still in America, we're all seeing these cases. I mean, we can't hide from the French Bulldog as veterinarians. So that's my case.
Very good case, Dr. Gladstein. We have a lot more videos to show, but I just selected one that I think were relevant, show before the condition, how difficult it was for the dog to walk and being incontinence, fecal and urinary, and then just seeing the progression with literally within a month and a half after getting 2 Alphaflo. That's pretty much it.
I have a quick question. Great case, by the way, Dr. Gladstein. On a musculoskeletal exam, does this dog have luxating patellas?
Yes.
Okay.
Absolutely. If it were not if it were my case and my client, which it is not, well, it's my case, but this is technically something we're rescuing, I would probably do something about those knees. And that would
Absolutely.
either be prolotherapy or I don't think luxating patellas do well with Alphaflo, but you could correct me if you've had good cases with that, with luxated
Uh,
patellas.
no, I mean it definitely needs correction from a surgical standpoint. I mean, I think it helps with the healing after correction, but just getting the alignment has to happen for sure. Do you know
And
what grade these were? Were they threes or fours? I mean, this dog looks very bow-legged.
oh, this leg was take a look at the x-rays. This dog is very bow-legged. This was I think the hips were the biggest problem here. And the luxations are probably 3 on the right side and 4 on the left. So
Yeah.
there's much more luxation on the left, but the left hip was also worse. So which comes first, the chicken or the egg here? I mean,
Right, right.
yeah,
No, but this is awesome that you took this dog and got it walking for sure.
right.
So,
It's not a dog that, the new adoptee this person has 2 other French bulldogs. So they're kind of familiar with some of the pathology that goes along with these kind of cases. And obviously, this is not a dog you're going to have hiking with you or you're going to allow to do steps.
And Dr. Mark, I know you've done several IVDD cases, and you want intrathecal. So also the
Yes.
idea with this study is to, if we can do something a little bit less invasive like IV and IP and see the clinical benefit and how long it lasts. I know the case you presented a few weeks back was intrathecal, your vet tech's dog. And one thing we really want to know is how long does it last, right? Are these good for 6 months? Are they good for more than that or less than that? So this will allow us to get some insight on those, the longevity of Alphaflo posts, in those cases.
No, I agree. I think, intrathecal, I call them exotic routes of administration. I mean, those are ones that, are probably not going to be used commonly in general practice for sure. But actually injected a dog intrathecal yesterday, still in the clinic, same thing, IVDD case. And I'll keep it one more day in the hospital, but it's starting to push against the back leg, or the back legs are starting to have some more tone to them today. When yesterday they were completely flaccid. So seeing some improvement with that one as well. And we'll just, like you said, time. It takes time to
Yeah,
let this stuff work.
Your
very good.
protocol
And we're
is
also monitoring adverse events, obviously. And then as far as we know, we have not seen any yet. Dr. Newland, we're gonna say something?
yeah, your protocol is going to be 2 treatments or 3 treatments.
Uh,
Two.
yeah,
Okay.
initially 2 at baseline and 1 month.
Okay.
And then when they go to their new home, we'll offer the third one at the 6th month.
If needed.
Well, that's up
Yeah.
to, that's your option.
All right, yeah.
Very good.
And we may not have CT scans for all cases, but if we can get some of them for confirmed diagnosis, that way we know for sure we're treating IVDD.
The Humane Society just got a new CAT scan, so they may actually participate with this exercise.
Yeah.
They're interested to see obviously it's New York City, and they do see their own large population of French bulldogs. So this
Did
is
they have
interesting to them.
did they have a veterinarian on staff?
Yes, they have 3.
Okay.
We're considering trying to do some sort of study there on arthritis, but we haven't been able to. We wanted to get this study underway, and then we'll talk to them about potentially getting their vets to participate in a small study on arthritis cases. But it's hard it would be very hard to isolate the breeds other than to have something like this.
Yeah, you don't hear of a humane society having a CT scanner. That's pretty amazing.
They're very lucky in that they have some very good and big donors. So people they've been supported by an elite society kind of client that just gives them money, donates them. I mean, that's what goes on in New York, where you're going to donate the money. And that's one of the places that there are a number of people that are giving them a substantial amount. I give them a small amount, but I couldn't have paid for the CT.
Well,
But
you're
it's
Wow,
doing
that's
great
awesome.
work, Dr. Gladstein.
That is awesome. Yeah.
So,
Yeah. And the good thing about humane societies is that they have a large population of pets. And so from a research standpoint, it also helps also, especially with Alphaflo giving, product that makes it really nice for these dogs.
well, let's get this one going a little bit further, and then I'll be happy to talk to them again about arthritis cases in general. I'll present to and I'll probably have you and Dr. Mark and Dr. Newland in on the presentation if possible. because I think that would be significant. I think they view me as more of an alternative vet, and because I do prolotherapy and I do a lot of other things. So it may be purposeful when we really get them presented if we have you on the presentation.
That'd be great. Martin, you have a question?
Yeah, not a question so much as just to adding on to this conversation.
Yeah, anybody,
Um,
please.
I have this, as you know, or some of you know, I have a 14-year-old French bulldog who has a multitude of problems, but one of them is IVDD, and she's pretty wobbly in the back end. And quite frankly, I had forgotten how wobbly she was until recently, and I know it's because she needs to have another. It's time for another dose. We're about 4 months out now, and
Okay.
so that's what I'm working on. Just trying to recoup from some weather disasters, and that's Linda and I are going to try and get together and give her another treatment. We've always done it IP and IV, but I think this time we're going to go IV because she had mast cell tumors in the IP area, and it didn't occur to me. So I'm thinking that'd be best to stay away from, even though they did get clean margins on the surgery.
For what
Well,
grade
when
they
you do
were?
it, let us know. Keep us posted.
Well, and you've told me several times to reach out to you, and I haven't yet about this, but more about some of the human products we were talking about.
Yeah.
So I will reach out to you.
Yeah, please. Do you have my phone number, Martin?
I do not have your phone number.
Well, I'll email you, or you can email me.
Okay.
I'll give it to you.
Okay. Thank you.
It's actually, it might be at the end of this presentation. Let me see here.
Okay.
This
But
is
you
my
know,
email address here. You can just email me here.
we can also look at this as rejuvenation for very old girls because she's an old girl. Dr. Gladstein, this little dog that you were working on recently, was there muscle loss in his legs?
Absolutely. But
Yeah.
between the first session and the Alphaflo, and then if you noticed, let's go back to the mat um, for stimulus, noxious stimulus. It's real easy, and these dogs are usually very hungry all the time. So the dog couldn't eat without stepping on noxious stimulus, which would have helped its proprioception and balance. So I don't necessarily approach this as Alphaflo will do the repair, but I also need to build the muscle back up. And the only way to do that is to get them to do something like this and balance themselves. And by the way, it started to really regenerate quickly. And
Okay.
I attribute that because I've done a lot of these kinds of cases. I attribute that not to just the mat, but the Alphaflo, the how rapidly this case went was it boggles my mind because I've been doing rehab since I've started practice 20 years ago. And this it doesn't get any faster, particularly in the incontinence route.
Okay. I've been thinking about trying some swimming, water aquatics when it gets warmer, but uh so a carpet and outdoor rough terrain wouldn't have the same effect.
Oh, yes. And if
Okay.
you can, I mean, rough terrain does, but this was like $29 on, it was not a big deal. It was an Amazon purchase. And I bought a couple of them just so it's so easy.
I'll look into it. Thank you.
And it's the kind of thing you take mud off of your feet. And I learned about that when I did horses. Yeah, to
Right.
get mud off your shoes.
That's what it looked like to me, was something that one of those heavy duty mats for your feet.
That's all it is. It's not,
Okay.
this is no, magic thing. It's, but that's going to get them to balance and that'll actually get them to start to build up their muscle again because they have to move to build up the muscle, obviously. So
Yep.
this is a cheat and a shortcut, quite honestly.
She was doing a flight of stairs once a day, and she's not doing that more. And I think, in some ways it was hard for her, but in other ways it was probably helpful.
Right. Or you can take them out in the, in the forest, in the woods or something, and just make them go on uneven pavement where the tactile feeling underneath their feet changes frequently, and that will give them enough noxious stimulation that
Right.
will then increase the nerve function.
Fortunately, that is my yard.
That
So,
works. Right.
yeah.
That works.
And now that it's getting warmer, she'll be spending more time out there. So, okay, thank you.
Any other comments or questions about that case? And then we can open this up to other cases you guys may have in mind or any questions?
I have a question for Dr. Gladstein. Since you're doing acupuncture, have you considered using the Alphaflo on your acupuncture points?
Yes, I have, and I do on my other cases, but we decided that this particular group of dogs, we weren't going to do that because we wanted a straightforward protocol that any veterinarian could follow.
Understood.
Yeah.
Thank you.
And I'm not saying you shouldn't. Actually, I do it in normal practice.
Right, I understand.
Anybody else has questions, comments on this case? Pretty straightforward. And we'll keep the group updated as we do more cases. This is our first case, but our goal is to do this with 10 to 20 dogs, which will give us a nice little cohort of data to be able to assess.
Christian, where are you planning on publishing this?
Well, I have not gone that far yet, but this study will technically be publishable. Yeah, I'm not sure of the journal yet, but
Okay.
will definitely be published in a peer-reviewed journal.
Open for ideas.
Yeah. Dr. Mark, if you have an idea, just let me know.
I do. Yeah, I can give some suggestions for sure.
So what we're trying to do is, obviously, we've done 7,000 Alphaflo cases. We've done 35 with our horse product. We have published 2 clinical trials with our equine product. One was a randomized blinded control study that got published in Vet Surgery Journal, and the other one was in the BMC. But we also have an ongoing TPLO study, randomized blinded control trial. I was with Dr. Dunphy, the PI, on that study over the weekend, and we have about 15 dogs enrolled and have completed the study.
That's great.
But the enrollment is 40 dogs, so there's still 25 more to go. Which that's what takes the longest, is to enroll these dogs. And these dogs are followed up to 12 months. The early time points are up to, I think, 60 days post-surgery, but we're looking at 6 months and 12 months for not just their healing responses, but any sign of delaying OA in those cases. I know Dr. Mark, you do a lot of TPLOs, and I know they tend to develop OA long term. So we're trying to see if we can, avoid that. And then, like Dr. Gladstein mentioned, we're also wanting to do a OA study, and this is open to really anybody who wants to be involved. The more centers we have, the better it is. And Dr. Mark is working on doing a retrospective safety analysis on 650 some cases he has done in 2025. So I appreciate all of you guys' effort to try to put some data behind the use of Alphaflo, whether it's efficacy and safety, but any of this is good for you guys and myself to know how Alphaflo can help your patients. And the frequency of administration of the product, how long it lasts, things like that is very useful.
Yeah, the more published, peer-reviewed published studies we can get, the better for sure.
Exactly.
Yeah, that's my goal within the next 12 months or so, is to at least, hopefully we can get this one wrapped up pretty quickly. But yeah, once you submit, a really well study, controlled study that this is not a controlled study. This is more of a single arm, unblinded trial, but still very, very good information. And then you can actually use that data to design controlled blinded trials, dogs with Alphaflo and dogs with standard treatment for IVDD cases and see how they compare. So all of this is to educate us on how to also better design trials moving forward.
Right. I mean, look, we could always try it with or without Alphaflo,
Yeah.
and not to use too many, just to do acupuncture uh, alone versus acupuncture and Alphaflo. I don't know, Dr. Newland, do you think that would be enough of a study?
Um, that I don't know. I think I think it's a harder one for the general populace of veterinarians to now
Yeah.
you've got two separate things here, and most of us aren't schooled in acupuncture. So I think I think what you're doing, something by itself, probably carries the most the credence for these cases.
Yeah.
So maybe we'll
Although,
have to do some
al-
of them without acupuncture.
yeah, although again, you, I mean, you've been doing it a long time. You know it works. It's kind of like again, some cases that I have, instead of just alpha flow, I'm doing something else along with it, whether it be light activated PRP or if the owner has cells stored somewhere. Um, that's basically those are hard to say exactly who who wins. Is it the alpha flow? Is it the PRP? So some of the cases that Christian and I have done are the Courtney case and the Ella case. Those both had stem cell procedures done with activated PRP. And then the only variable that we changed was we added alpha flow, and it made a huge difference. And I think that goes back to the study of UC Davis. Gives better direction to cells. And again, alpha flow is a much more potent activator than what PRP can ever be. So, and again, you may very well know, which I don't, acupuncture may very well, open up areas to where it lets alpha flow work better. So I think, keep doing what you're doing. And, for a peer study, those are always hard to do because what you're trying to do is you're trying to get these dogs adopted. You're doing whatever you can do to get them adopted.
Exactly.
So,
Yeah.
you know,
Yeah, that's the thing. When you do studies and you have especially a controlled study, then the control group may not do as good, but what you can do is you can modify, you can have a adaptive study where, let's say at a time point, let's say 2 months, if the control group are not getting any better, then they can get alpha flow. So there are ways to do that. But right now, I think pure alpha flow cases is kind of what we need to know what alpha flow does by itself.
Well, let's see what the volume is,
Yeah.
going forward, if they're going to have other dog, how quickly that they can fill the pipeline
Yeah.
with these dogs in this area, because it's not just going to be, it's a national rescue organization. So that's why we made the protocol kind of simple with the alpha flow. And if they don't use acupuncture, obviously you're correct. Not everybody's schooled in acupuncture. So, that could be a variable.
Yeah.
I like the administration though. You made it simple. Pretty much any veterinarian can, a new grad coming out of school can inject IV, and if they need to have something on the AlphaFlow site that Dr. Mark will put together on which he has already video of doing IP injections, now they have information to be doing needle surgery. So again, it would have been difficult, I think, to find enough veterinarians that are willing to do intrathecal. So this will be a good study.
Yeah, and that's why we did that. And also when we do the OA cases, we really need to think about the study design. I know Dr. Mark, you do all your OA cases IV, if I recall. And then you do IV or you do direct and joint injection.
I'll do joint injections, IPIV.
Okay, so you do them all.
Yeah.
Yeah. So it'd be nice to have like maybe like three arms. One is joint injection, the other one is IV, and see if there's actually any benefit by going directly into the joint. I would think there would be. But
I think for sure with OCD cases or OC cases for sure.
for sure, yeah, you want to go
You're
into
gonna
the
have to
joint
put
for
that.
that.
Yeah.
Yeah. Any other cases besides this one you guys want to talk about? Dr. Glasstein, you have anything else?
Well, I
Any
had
other?
that very complicated case that I wanted Dr. Newland to see with the exaggerated red blood cells. And that client would like to try Alphaflo. And I just wanted to consult with you about that case. It's a little complicated, but at least we have one ultrasound on it. Did you get an opportunity to take a look at it?
Uh,
Case.
I don't, Dr. Neal, I don't think you, no. I have
Okay.
not sent the,
Oh, okay. Well, at some point,
but
it's
I'll send you, Dr. Newland, the records from the patient. I can actually bring it up right now if you guys want to.
well,
Well, is
you
it
can
when
say
you
it's complicated case.
Yeah, it is, but it is, yeah, the red blood cell, everything is pretty high, right? If I recall.
Yes. And it may be from splenic contraction, although I'm just, and it's consistent. It may be a normal, but I just want another set of eyes on it with more experience than myself with these kind of cases. It may be an early oncology case.
Yeah, so what's the in people to where they have to go give blood? Hemo Vera, it's what is it, Mark? It's
Oh
Molly,
yeah.
go ahead.
it's
They got to do a little bloodletting.
yeah. So, but
Yeah.
I've never heard of or seen a case in veterinary medicine. But
Either.
so what's the red blood cell count?
I don't have it in front of me.
Well, is it?
Right.
Well, I mean, typical is going to be 6 to 9 million.
I actually do not have any of it in front of me now because
Let
I just,
me,
but you would have.
let me bring it up just with, I don't need to show it, but let me just bring it up real quick. Um,
One of the things I would think about, I mean, depending on how exaggerated the red blood cells are, is the female in the house putting estrogen cream on herself and the dog licking it.
The current owner is now 8 months pregnant.
Okay.
Don't think that's happening. But if you could review the case at your leisure and at some point, I wouldn't mind you taking a look at it because I just was flabbergasted. I've never seen it before. But I haven't seen everything because I became a veterinarian very late in life. So my experience level is not yours for sure. And my caseload's not yours.
We can see,
uh,
we can see, you know, differences amongst breeds. They don't always have to be falling in that 6 to 9 million. I mean, a 10.5 million wouldn't bother me. But if I did see one that was at 12 or 13 million, that would probably bother me. Yeah, you're not that high.
so this is just one of the records. There's a lot that I have, but this is kind of what it looks like here. It's kind of on the
Yeah,
eye
so
end, but I'm not, I'm not
9.97.
of it.
I'm not quite so sure. What's the clinical signs? I'm not quite so sure that this dog has
There,
a
there's no
disease.
clinical signs.
Yeah, I'm probably saying not all of us fit into the bell curve. And this dog, what's the breed? Bichon
Uh,
Frise. It wouldn't be.
Bichon Frise.
Yeah, I mean,
It's a big one. It's not the typical Bichon Frise.
I would wonder. I would be more apt. I probably wouldn't throw anything at it. I'd be more apt to continue to watch it and see what it's going to do over the next 6 to 12 months. But this just may be one of these dogs that do not have a disease problem. They just pack, and it's them, and they're not fitting into the bell curve. But I wouldn't get too excited unless it was 12, 13 mil.
Well, they had some problems ocularly and some blepharospasm and some allergy problems. So we're waiting, and I've changed the diet, and I'm waiting until they go full blown allergy time to see how how much um, how much of an affectation the dogs start to have during season. And then obviously I wanted to see what your opinion was. And then I was considering the client would definitely consider Alphaflo if the allergies start to pick up. But before I do that for allergies, I'm looking at this and I'm going, I've never seen anything like it. So
Yeah, I mean, looking at this RBC hematocrit hemoglobin, and jump in, Dr. Mark. Um,
please,
they're kind of all equal. So as opposed to a true anomaly or a disease process going on, I think this is just this dog. I mean, if it's not having any clinical signs, I don't think I would be looking for a disease because I think it's just this dog. But I would be more apt to monitor it. I'd be more
Yeah,
apt to go ahead.
I would agree. I would monitor this. A couple things. One, dehydration can do this, and so checking their status on how much water this dog's drinking, hydration status. What's the elevation there as well?
oh, it's New York.
So are y'all
We're all
y'all are
sea
basically
level.
sea
We're
level.
below sea level.
Okay, so yeah, I
That's a
mean
good point, though,
sometimes
Dr.
you'll get a
Mark.
little polycythemia up in mountainous areas.
Right. Yeah.
These guys trying to compensate, but I would I like Dr. Newland. I wouldn't get super worked up over this if it's non-clin. The dog's not clinical.
So just treat it with the if the allergies start to pop up again.
I would. Hmm.
Okay.
Yep.
Thank you.
You're welcome. I
Hey,
assume
hello.
that's an
Yeah.
erroneous glucose.
Yeah,
That
51.
51.
Oh, do you want me to go back down and look? Yeah. Is that what you want to look at?
No, we
Go
wanted the glucose.
go to
Oh, what you
It's
said.
glucose.
51.
Yeah, it's 51.
I spun it right,
Okay.
at the appropriate time, so that wasn't the issue.
Wait, well, yeah, no, I'm 51 just seems I'd probably repeat some blood work. That's what I think I would do before necessarily trying to get theory on how could alpha flow affect a polycythemia vera if that's what it is. I mean,
Well, I have prior blood work that shows the same thing.
Yeah,
So
I'm gonna bring it
that's
up.
when you say that that may just be the dog's normal, actually, that's the other vet's observation that that's normal for that dog.
So that's the prior blood work here.
Yes, prior blood work.
And then the glucose on this one is,
Normal. Yeah, it's normal.
yeah, normal. I'll bypass it. Yeah. Yeah,
Yeah,
normal.
right there, 95.
Yep.
I'd watch it. I'm
Yeah.
I'm still trying to think of theory if indeed it is real, and they start showing, you know, episodes of nosebleeds or other type things, then you know I'm just still not quite so sure how Alphaflo would turn that around. But
Well, Alphaflo would help with the allergies.
well, yeah, but
Right.
allergies don't necessarily affect the red blood cells.
No, of course not. That's why we're looking at this.
So, but yeah, I mean, be interesting though. Let's say if they do want to do Alphaflo for the allergies, then I'd probably repeat some blood work, you know, 2 months afterwards and see. I mean, if it takes a dive down to something that nobody has seen in this dog before, like a typical, you know, 6.5 or 7, 7.5, who knows? I mean, who knows?
Right. It was a little weird. Okay. Thank you.
You're welcome.
And I put in a few cases now where we're testing, we're doing that cancer test, the NUQ, and I put in two, and we'll see what's going to happen with administering Alphaflo if the NUQ comes down.
Okay.
So, Glastin, we talked earlier about the black Labrador
Right.
with lymphoma. So I do want to present that case. I know the NUQ test, the baseline was 641, and they came back to 41, basically within normal range within a month of Alphaflo.
Correct.
And then that dog, this has been a few months now, but that dog, as far as you know, is still cancer free.
As far as I know, they're in Hawaii at the moment. I won't have them back until April 15th, and then I'll
Right.
repeat the blood work and we'll see what we have. In the meantime, I have two other cases, and we'll see if we get remission of the NUQ after Alphaflo. I did one that had a breast mass, and although it had been tested by a prior vet and it was nondescript, and I took an NUQ on that one. But in between, I injected around the mass, and the mass, I inspected it 2 days ago, and it was soft and much smaller. But I'll have the NUQ in probably another few days. So I'll be able to present all three of those cases, Christian, probably somewhere around the end of April.
Perfect. When the black Labrador comes back and you do the blood test around the 15th,
Right.
and then that'll be a good 6 months follow-up. So we could definitely do that one, present that case.
Right. And then I'll get to see if the one I injected around that mass on the breast, what that NUQ actually is. And the client's given me permission to inject around the mass again, and we'll see if that continues to go into some sort of remission. I hate to use that word when I'm just talking about a mass that supposedly is non-neoplastic. I don't know that. It was a fine needle aspirate, so anything goes with that stuff.
Very good. All right. Well, that was a good session. Thank you very much, everybody. Any last minute comments? Tracy, do you have any questions, or Martine or Dr. Deschambault? All good?
All good. Thank you so much, Dr.
Oh,
Gladstein.
good. Thank you.
Very
Well,
good. All right, then we will reconvene in 2 weeks.
Sounds good.
Awesome.
See you then.
Thank you.
Good
Happy
night.
Thank you, Christian.
Thank you,
Easter,
guys. Thank you,
everybody.
Dr. Gladstein, for the case.
thank you. Okay. Have a
Bye.
good night.
Night.
Oh, actually.